I'm going to begin by palpating the PMI. That's at the 5th intercostal space in the midclavicular line. And I'm unable to feel it, most likely because he's wearing clothes. Now I'm going to listen to the heart sounds. First one is the aortic valve. Second is pulmonic. Then Erb's point. Tricuspid. And mitral. S1 and S2 are best heard at the apex of the heart, and now I'm going to listen with the bell. Okay, and now I'm going to listen for a mitral murmur. There is none heard. Next is the carotids. We're going to start with the left. It's strong, but no thrills are felt. And the right. That's the same, no thrills felt. And now I'm going to listen for any bruits. Okay. And no bruits were heard. Now we're moving on to the respiratory system. So right now, counting his respirations. He's at 16 per minute, which is within the normal limit. His rhythm is equal, minimal effort, and appropriate depth at this point. There's no accessory muscles being used, no abdominal muscles at this time. So at this time we're going to move, I'm going to have you switch and turn around so you're facing the other way. Yep. Yep. Alright, so now I'm going to palpate for respiratory rate. Lung sounds are equal bilaterally. Now we're going to do tactile firmness, so I need you to say 99.
99.
Again.
99.
Again.
99.
Again.
99.
One more time.
99.
Okay, good. And we're also going to be percussing lung sounds. So we're going to be starting with the posterior breath sounds so that the patient doesn't have to move as often. And we're going to start with the vesicular breath sounds found at the second intercostal, 4th, and 7th. Kitty, give a deep breath for me. And out. You good? And out. Another. And out. Again. And out. In. And out. And one more. Okay. Now I'm going to have you turn around. back to the front, and we're going to do bronchial breath sounds. Okay, and then bronchiovesicular breath sounds are similar, so we're going to do those here. Again on the other side. And then okay. For bronchiophony, what you do is you also take the stethoscope while the patient is saying 99. If there's any increase in the volume, that's what would give you the indication for consolidation, suggesting fluid buildup or even something like cancer. So I'm going to have you say 99 again.
99.
Again?
99.
Again?
99.
And another.
99.
Okay. All right. Now we're going to go ahead and move on to, sorry, I'm trying to think, we have to have you lay down for this. Moving on to the abdominal examination. So I'm going to ask you to get off the chair here for a minute. I'll have you just lay down on the floor, and I'll make sure I can see you in the camera there. Yep, that's good. Okay, so at this point, we're going to begin by looking for any contour, symmetry, any lesions or masses, and any visible pulsation. So I'm going to move your shirt for a minute. There we go. Okay, so it's flat, symmetrical at this point. No lesions are noted right now, no masses. And right now we're looking right here for any visible pulsations of the aorta, and that is not seen. So next I'm going to listen for bowel sounds. Starting with the right upper quadrant. Move to the left upper quadrant. Left lower quadrant. And right lower quadrant. Okay, and they're audible and active in all quadrants. Next, we're going to listen for any, for the aortic artery. That is not heard, and then we'll move on to the renal arteries. And listen bilaterally, along with the iliac arteries. Okay, nothing abnormal noted there. And lastly, we're going to palpate, and you have to let me know if you have any pain at that point, and I'm also looking for masses. So the abdomen is soft and non-tender. No abnormalities were noted there. All right, now I'm going to have you can go ahead and sit back up here. The last thing we're going to do is make sure to see you in the camera. Okay, last thing we're doing here is your peripheral vascular. So we're going to do upper extremities first. So at this point, we're looking at hair and nails. They look in good condition. The hair is evenly distributed on both sides. There's no edema, no swelling, no redness. The skin is intact except for just a couple minor scrapes on the hands. So we'll go ahead and check capillary refill. Okay. and both hands are less than 3 seconds, which is great. And we're going to go ahead and palpate your pulses. So we're looking at brachial first. That's at a +2. Radial is a +2 as well. And ulnar is +2. I'm going to check the other side. Brachial on this side. +2. Radial. The radial pulse is bounding a little bit, so that's a +3. And ulnar here is +2 again. Next we're going to do legs. So if you don't mind, I'm going to take your socks off.
Okay.
Alright. So again, looking at the skin here, skin looks good. Just again, some minor scrapes here and one down here. For hair distribution, everything looks good except for a couple patches right behind here. Looks like they've been rubbed off though, rather than no hair is growing. So that doesn't indicate any arterial insufficiency. There's no varicose veins that I can see, and there's no swelling. Yeah, no edema noted at all, either in the feet or the ankles. None behind the legs either. Okay, so capillary refill, or check that as well. That is less than 3 seconds. So we're going to go ahead and palpate the pulses. So popliteal. That one is very hard to feel well. I've found it. It feels like a +1 at this point, but it is pretty deep, so sometimes that is hard to feel. Check the other one as well. Okay, there it is. This one is actually +2. We'll go ahead and look at the posterior tibia pulses, which are behind the foot here. I'm going to have you just relax it. Relax your leg against my hand, and I'm going to feel with my other hand here. That's a +2. We'll go ahead with this one. Just relax it. That's a +2 as well. And then we'll move on to the pedal pulses. That's a +2. And a +2 as well. So overall, nothing malignant found on this individual. A pretty healthy exam at this point. Thanks.